NDP MPs are calling for CEOs of for-profit health clinics to testify about what they're charging. Conservatives and Liberal MPs shut down their latest motion, but the rise in for-profit health clinics is hard to overlook. In the past few years, private healthcare clinics have popped up right across the country, offering a variety of services. And while some argue these alleviate the pressure on our public health system, others say it's eroding it. For more this morning, we're joined by Dr. Jane Philpott, former Federal Minister of Health and Dean of Faculty Health Sciences at Queen's University. Welcome back.
Thanks for having me.
You know, we last had our discussion about this, or touched on it anyway, when you released your book about a prescription for healthcare here in Canada.
Yes.
Can you explain in broad strokes, first of all, how this for-profit or cash model works when we're talking about clinic care for clients in Canada?
It's a great question, and it's really important to get the details right. There are lots of private clinics. In fact, many family doctors' offices are private clinics. The concern that the NDP have and many others have is the concept of people paying for access, cash for access into your family doctor or any other part of the healthcare system. And the fundamental tenet of our national insurance system is that for medically necessary care, you should get that care based on your need and not based on your ability to pay. That cash for access actually erodes the public system because it drives people into a system where they get to the front of the line, leaving most of the rest of the Canadians waiting for care.
What happens in these models now, though, is that it's not called, obviously, cash for access, but they'll offer extra services that you pay privately for, and somehow that seems to speed up your access.
Yeah, so this is a bit of a loophole that we're seeing sometimes where there will be add-ons, supplementary things that you have to pay for in order to be able to get the care. And that is a slippery slope getting into care. I mean, the reality is that we do have a problem in our healthcare system. People are not getting access to care. There are 6.5 million Canadians without family doctors. So clearly there is a problem, but that knee-jerk reaction to say it will be solved by a for-profit corporate mechanism is not the answer. The answer is to actually properly build a public system with access so everyone has the care that they need.
I feel like the tide is building, though, and the pressure is coming, and it's like water. It's finding its way through the cracks, and I'm talking about private and access healthcare. What are your concerns when you see big corporations wanting to set up shop as for-profit healthcare in this country?
It's not going to solve our problems. It's going to take us to the kind of system that we see in the U.S., where they pay significantly more than we do per capita for healthcare, and they get worse outcomes. I agree with you. There's a tide of energy coming.
Yeah.
I'm hoping we can flow that tide of energy into improving our access to care so everyone will have, for example, a primary care home in their community.
Healthcare used to be one of the pillars of this country, and it was a point of pride for us. When we see this, I guess erosion is what some people are calling it, and this move towards privatized healthcare, some clients will say, they make the argument that, well, I'm relieving the system, right? I'm allowing more people who can't pay to have access. What's your response to that argument?
The problem is we don't have unlimited resources, and particularly we don't have unlimited resources of the doctors and nurses that are necessary to operate a healthcare system. So the more that you take out of the system to people who are paying to be able to get to the front of the line, the longer the queues become for everyone else. And ultimately, we all will pay the price because we have to care for people. And if we make them wait because somebody else has jumped the queue, it will end up costing Canadians more.
Really quickly, one last question. Is it legal?
It's not legal to pay for access to medically necessary care.
But the loophole is this extra services.
There are a bunch of loopholes, and they always seem to be found. But, you know, thankfully, Canadians at the end of the day have said repeatedly that we want to uphold our national insurance system. It's on those of us who are involved in trying to make a better system to take away that frustration by actually improving access to care.
I always wish we had more time for this conversation because I do think it is one that people have every day in their households and decisions they have to make every day. Thanks for coming in, Dr. Philpott.
Thanks.
If you liked that video, make sure to subscribe to the Your Morning YouTube feed where you can find all kinds of new content posted every weekday morning.